a problem when you're asking the patient to really take charge of their treatment. So what problems do you notice with these plans? And I know you can't participate at this point, but I want you to just suggest that you ask yourself some of these questions. So first of all, alcohol dependence, in responding to this, is not a diagnosis, and a diagnosis is never a problem-driven, is never a problem statement. And as I mentioned, program-driven plans often do use a diagnosis as one of the major problems. Obviously, these statements are not written using a complete sentence structure. They're not individualized, and it really doesn't provide you enough information to tell whether this is a problem for Dan or Jan. In an old method or program-driven plan, a goal statement might say, and these are actual statements that were found in treatment plans as we developed this training and as the researchers described some of the statements they viewed. The goal being will refrain from all substance use now and in the future. Take a look at that for just a moment. Obviously, this goal, we couldn't really ascertain who that was referring to, whether it be Jan or Dan. It's not specific enough. Really not helpful for treatment planning. And in light of the fact that it mentions that substance use now and in the future really is not specific enough to really be accomplished realistically before program discharge. And nobody knows what in the future means. The old method of program-driven plan, an objective statement might say something like, we'll participate in outpatient treatment.